Hi there, welcome to Module 7 Readings. Today I will be discussing the following references. So Chapter 4 and 5 from the course text, Interaction Design Beyond Human-Computer Interaction. Also I'll be discussing Chapter 20 and 26 from the Handbook of Human Factors and Ergonomics in Healthcare and Patient Safety. In addition, I will be discussing healthcare in the pocket, mapping the space of mobile phone health interventions. And finally, I'll be discussing the characterization context for mobile user interfaces in healthcare applications. So first of all, we'll start with the book Interaction Design Beyond Human-Computer Interaction. So Chapter 4 discusses all about the social interaction. It focuses on how communication technologies change how people affect in life and interact in life within work and social networking and also in day-to-day life. The definition of social is interacting with each other, and the interaction of this is really important. The basis of all current social interaction is face-to-face communication, and this is still used day-to-day while we go on with our lives. However, social media use has increased significantly over the last decade, and this involves communicating online via instant messaging, emailing, texting, Skyping, and Facebooking, etc. Social interaction is really important for many aspects of our lives. Communication has evolved to facilitate conversation, collaboration, and awareness. Talking is very important, and it is very important when you consider social interaction. In regards to this, there has been a massive development in the computer-mediated communication, which has increased interaction with one another. And now, when you go home from work, you can still contact people at work via email. When you leave a friend's house, you can still communicate and say, "I got back safely," which before, without this kind of technology, wouldn't have existed. And finally, another definition here: collaboration and socializing involves communication of what you are doing and knowing what others are doing. This, in terms of technology, involves updating your status on Facebook or sending out a tweet saying you need help. Chapter 5 of our course book was about emotional interaction. This focused on how we feel and how we react when we interact with certain technologies. And developers use this to elicit different feelings, i.e. positive feelings, and reduce negative emotions. It's been shown that badly designed interfaces cause frustration and anger, whereas aesthetically pleasing software gives a pleasurable feeling and elicit good feelings. So developers want to enhance that pleasurable feeling and reduce a negative feeling. These emotions may lead to realization of the need of the product or technology. So if someone goes onto a website and views a product, if it's easier to get to and easier to access and understand, there's more likelihood that they will go ahead and purchase or feel that they need that product. Also, it may invoke anticipation of what is coming next and wanting to keep exploring that website or that application. Finally, it may push that user to go ahead and purchase the end product, which is very profitable for companies. Effective computing attempts to develop computer-based systems that recognize and express emotions in a human-like fashion. This is caused by expressive interfaces, i.e. using graphics and expressive icons which convey emotional states. This can include animation, spoken messages, sound, for example, which shows a recycling bin being emptied, which validates what the user has done and has worked correctly. It can provide feedback and reassurance that what they set out to do has functioned well. However, there is a negative side to this, and some users feel like it can be intrusive and invoke anger. i.e. when you hear the ever sound, it may invoke anger. Therefore, it's something that doesn't want to be felt. So now we move on to human factors in telemedicine. I will explore chapter 20. The definition is medicine at a distance. This can be through teleconsultation, teleeducation, telemonitoring, telesurgery, and telehome care. And these again in the last couple of decades have enhanced significantly. The advantages is that it can have a positive impact on the quality of health and quality of care. It can improve the efficiency of care and also of reporting. In addition, there is talk about whether or not it may improve patient safety. If everything's recorded via telemedicine, it may well eliminate human factors. In addition, the advantage of cost effectiveness in the long run is there. However, there are several barriers of implementation, such as the time it takes to go ahead and implement that software or that application. The initial cost may be great to have developers, and also later on when you need to have someone to maintain that software or that application for the telemedicine, it may be costly. There's a risk that it may go wrong or that things aren't set up as they should be. Usability is a big problem as well, where the system itself may not be user-friendly. There's also a general resistance to change, especially with people that have done a task a certain way for a long time. To go ahead and bring in a new aspect, there may be some caution and some resistance there. Now I'll talk about chapter 26, which is the human factors engineering of healthcare reporting systems. So there has been a high-level survey of human factors issues involved in the reporting of diverse healthcare events. There may be underreporting, and this may be because there's a bias in that reporting itself. So if there are mistakes that have occurred, people are less likely willing to go ahead and report that. Also, many different organizations have different ways of reporting, therefore it's very difficult to go ahead and put them together and measure them against each other and the outcomes and share that information. Also, many hospitals and organizations have a gatekeeper scheme where someone has to go ahead and analyze that information before it's shared to other users. This may prevent or may minimize how much information is passed online. Also, in addition, bringing all the information together where different risk factors, different measures have been taken in regards to the reporting, it may not go ahead and be able to put it into one unique report. Now I'm going to speak about the healthcare in the pocket, mapping the space of mobile phone health interventions. So mobile phones have been seen as an important way of delivering health interventions. It has been recently used as a tool to encourage physical activity and healthy eating. This has been used as a symptom checker and also as sending reminders. Why mobile phones? So mobile phones are seen as ubiquitous. They are everywhere now. More than 20 years ago, more than 10 years ago, more than 5 years ago. People are at a younger age receiving mobile phones and they are using them more often. Furthermore, mobile phones are always on the person, more than a desktop, more than a tablet. Mobile phones are seen as always on the person, therefore very accessible. Mobile phones can become very personal to a person. They'll have their own password, they'll have their own theme, they'll have their own images and photo gallery. Therefore, a mobile phone will entice a deeper connection to any applications on that screen. In addition, that mobile phone can carry a lot of information about a person which may be beneficial when it goes to healthcare reporting. So different areas of mobile phones are used for interventions. So using text messaging, using a camera, using native applications, automated sensing, and internet access. How do they use these? They use this by either tracking health information, getting the health team involved and interacting with that user via mobile phone applications. Can improve peer support. So someone who is trying to quit smoking may contact their relative or their friend via text message and seek advice, or their peers may go ahead and contact them and again encourage them to stay on the right track. Health information is also relayed in a positive way. Reminders can be sent, and also mobile phones can be used to convey health messages in a fun way via interaction, using your user, different ways of engaging that user via the mobile phone. Finally, we're going to speak about the context-based user type stereotype model for mobile user interfaces in healthcare applications. This study looked at a hospital in Saudi Arabia and found that there are 3 groups of doctors in hospitals: junior, intermediate, and experienced. The study analysed the domain experience and mobile experience of these 3 different groups, and it aimed to use this information to go ahead and adapt a mobile user interface for applications, for healthcare applications. It found that the age group for junior doctors was between 22 to 34, intermediate was 34 to 44, and experience was 45 plus. It found that junior doctors were more likely to have a domain experience and also smartphone application experience compared to experienced doctors. And that's the end of the presentation. Thanks for listening.